use marijuana. Many of those people, when they don't have access to marijuana, they binge drink. And when they binge drink, the problems associated with that are magnitude. We all know the problems associated with it. And so the argument in a state like Colorado that has seen a lot of problems at the University of Colorado and other places with drinking is that if individuals have access to marijuana, they will not binge drink and just use marijuana in moderation, where, as an earlier caller described, the person might laugh a lot.
Let me respond to that if I could. You know, what we should not do is take one problem that is bad and then add another problem and make it worse. One thing that I think Alan and I agree on is that alcohol can lead to problems. It can lead to addiction, it can lead to dependence, it can lead, over drinking can certainly lead to death. But take a look at the numbers. There are about 126 million alcohol users in this country. We have about 14.6 million marijuana users. Now, nobody would disagree with the fact that there are problems, both health problems and even driving under the influence of drugs, etc., associated with marijuana use. Do we want to increase, if we want to treat marijuana the same as we treat alcohol, and if we think about the risk of that involving a nearly ninefold increase in marijuana users in this country, is that truly the approach we want to take in this country?
Yeah, well, I think by regulating and controlling it, we can then get the benefits of regulation.
San Diego, California, on our line for Republicans. You're on the Washington Journal.
Good morning. I just want to say to Mr. Horton, I consider myself a Goldwater Republican. I thought that Republicans wanted government out of people's lives. What you are doing, sir, I must tell you, is getting government in our lives from a federal level. I think money would be better spent on people like you to do something at the federal level, like maybe go over to Iraq and help finish off this war instead of worrying what someone's doing in their house smoking pot. Now, I don't smoke that stuff, and I don't even drink anymore. But I tell you what, I've been to parties where people are smoking marijuana. I never saw one fight break out. I go downtown here to San Diego, people are drinking and they're fighting each other. They're getting in accidents. I'd much rather see somebody smoke a marijuana cigarette than drink a bottle of Bacardi 151 or a bottle of tequila.
John Horton.
Well, I'm not quite sure what the question was there, but let me respond to part of that. If you go to treatment centers, drug treatment centers around this country, and as I have in this job, and if you ask people who are there for a problem with cocaine, with heroin, with methamphetamine, whatever it might be, what did you start out with? Now, alcohol and cigarettes are certainly going to be a part of this. I'm preempting my opponent's comments. But you are universally going to see the vast majority of people will say that they started out their illegal drug use with marijuana. What we want to see in this country is we want to see drug use go down because of the social problems that are affiliated with it, especially for youth. We've succeeded in seeing a 19% decline in drug use in this country among teenagers over the last 3 years. We all win when that trend continues.
Our last call comes from Sedona, Arizona, on our line for Democrats. Good morning. Sedona?
Yes, I'm here.
Go ahead.
Can you hear me?
Yes, ma'am. Speak up. Go ahead.
Okay. I just think that, you know, the previous caller just took my thunder, but, you know, I have, you know, 4 sons, and believe me, I'd rather see them smoke marijuana over drinking alcohol any day. Any day. I see what alcohol does to kids and how dangerous it is for them to be driving under the influence. When they drink, it changes their whole personality. When they smoke pot, maybe they get mellow. What is the crime in that?
Alan St. Pierre.
Well, I think if I'm not incorrect, we did not take a single caller today who disagreed with who agreed with the federal government's position. That needs to be noted. But let's just backtrack a little bit here. Marijuana is not a gateway drug. It is the first illegal drug that people use because after 70 years of prohibition and the DARE program and the Partnership for a Drug-Free America, it doesn't work. People are in treatment for marijuana, not because they want to go there for marijuana, Mr. Horton. As you well know, we have things called drug courts today. And when you go to the drug court, they give you a choice, a Hobson's choice, between going to treatment or going to jail. I, of course, like you, would go to treatment. So it's a very false sense of data to put out here that people are going to treatment for marijuana. It just simply isn't the case.
Well, no, actually, if you look at the data and if you look at why people go to treatment, whether the drug is for methamphetamine, whether it's cocaine, whether it's alcohol, whether it's marijuana, in all of those cases, about roughly half of those begin with some sort of a criminal justice intervention.
Yes, they're referred through the criminal justice system.
And we're going to have to leave it there. We've been talking about Colorado and Nevada ballot measures to drop penalties for possession of less than an ounce of marijuana for people over the age of 21. We should also mention that communities that have measures on their ballots also next Tuesday include Missoula, Montana, Eureka Springs, Arkansas, Santa Cruz, California, Santa Monica, and Santa Barbara, California, as well as South Dakota has a measure for medical purposes. We've been talking with John Horton of the White House Drug Control Office and Alan St. Pierre of the National Organization for Reform of Marijuana Laws. Gentlemen, thank you both for being on the program.
Thank you.
Thank you.